Good evening. Good evening, all of you. How are you all? You're meeting after 2 days. How are you all? Am I audible, guys? Am I audible and am I visible to all of you? So, what is good evening, all of you. So let us start discussing now. Now don't tell me today you have biryani. Whatever it might be today, we have to sit. Okay? Right? You guys, there is constant process of reproduction happening in the animals. Constantly the eggs will be generated, constantly the chicks will be hatched, constantly you'll be getting chicken all the time. So constantly the biryani also will be made. So nothing is going to happen. Let us just start discussing the topics. Okay? So previous class we discussed, all of you are able to see the screen also, right? All of you are able to see whatever I'm writing on the screen, right? Right. Sorry. So, so as last class we but ये बताओ last class कहाँ तक discuss किया? Last class we have discussed about one bacteria which causes problem to your brain. What is that? Any idea? Be fast. Hasti, Royal Ratna, any idea? Very good, Nidhi Jain. Very good. Nidhi, you are in the previous class. I hope you are not in the previous class. You are there. Right. Very good, Fatima. Meningitis, right? So that is your meningitis. Now, we discussed here two important types, right? One is meningococci, another one is called as gonococci. We discussed all the important points in meningococci. We have discussed all the important points in gonococci also, right? Now, regarding meningococci, we have discussed what are the virulence factors and all, right? We discussed what are the different types of problems you have got. So, what is the most severe problem? The most severe problem is meningitis, right? Most common problem is rashes, okay? And most important complication is bilateral adrenal hemorrhage, okay? This is what we discussed. And regarding vaccines, we discussed, but we did not discuss regarding gonococci, right? Hope all the 30 students here who are there, all of you are understanding whatever I'm telling you. So we did not discuss about the gonococci. Now gonococci, coming to gonococci, let us look at the clinical manifestations of gonococci. Okay, very good, Fatima. So coming to this gonococci, actually gonococci causes disease in men. It causes disease in women. It even causes disease where in neonates also. Causes disease in neonates, men, women, as well as neonates. For example, what are the diseases that are caused in men? What are the diseases that are caused in women? And what are the diseases that are caused in neonates? So we shall be discussing into three categories. Okay. What are the diseases of gonococci caused in men, women, as well as neonate? Okay. Now, first of all, let us start from the men. Now, here, let us say that these are the kidneys. Okay, these are the kidneys over here. And these are your ureters. These are your ureters. And this is the urinary bladder. And this is the urethra. All of you also should know here, on either sides, we have got a gland like this. This gland is called as what? Anyone, any idea? What is this gland? Very fast, B, fatafat. Answer fastly. What is this gland? Very good. This is called as your prostate gland. I want every one of you to answer the question here. Very good, Aditya. It is prostate gland, right? Now, what I'm telling you is that in these patients, normally because of unprotected sex, okay, because of unprotected sex, sometimes what can happen is that these gonococci can land on the urethra like this, okay? Once the gonococci will land on the urethra, obviously it will cause infection here, right? That infection you call it as urethritis. What is that? Urethritis. This is urethritis. Now, what will happen because of urethritis? Patient will have an abnormal pus discharge. So, any young-aged male who is coming with abnormal pus discharge from the urethra, most commonly this will be gonococcal urethritis. Okay. Next important thing, this infection can ascend up. Yes or no? This infection can ascend up all the way and enter into your prostate gland also. Once it will enter into your prostate gland, patient will have prostatitis. Patient will have what? Patient will have prostatitis. Okay, inflammation of prostate gland. Next, the infection can ascend up into the urinary bladder and contaminate the urine in the urinary bladder. So, if urinary bladder is infected, this condition is called cystitis. What is this condition called as? This is called as cystitis. So, what are the three most important problems which you would see in a patient? The first important problem is cystitis. Second important problem is prostatitis. Third important problem is urethritis. These are the three. Out of all these three, which is the most common problem? The most common problem is urethritis. This is the most common problem which you would see in a patient. Yes or no? All of you understood this? Yeah? Urethritis will be the most common problem. Right. Now, these are all the problems which you would see in case of men. Gonococcal cystitis, gonococcal urethritis, gonococcal prostatitis. Most common is gonococcal urethritis. How will you diagnose it? You will diagnose by the presence of pus. Okay, pus discharge from the urethra. Clear, all of you? Right. Next important thing, when it comes to the women, what are the problems which you would see? For example, let us say, right. For example, let us say, okay. So let us say that this is a vagina over here, and this is a clitoris, and here you have got the anus like this, and this is the mons pubis area. Right. Now here, this is just a rough picture. Now here, you can see here, this is the anus. The last one, the last point over here is called as your anus. Now in the females, what will basically happen is that surrounding the anus, okay, surrounding the anus here, there are abscesses that are formed. Okay, so surrounding the anus, if abscesses are formed, can I call these abscesses as perianal abscesses? Perianal abscesses. What are these abscesses called as? Perianal abscesses. Okay. So these perianal abscesses, all of them, they join together to form a very big, very big room. Okay. See, one abscess will burst out, that will communicate with another abscess, that will burst out, that will communicate with another abscess. So overall, when you see, you will see a very internal cave or internal empty can-like thing inside the anal region. Okay, that you call it as water can perineum. What do you call it as? Water can perineum. Just look at this picture here, you will understand. See, this is the anus. Okay, surrounding the anus over here, you see abscesses, all these abscesses. Now when we cut down these abscesses, see, surrounding the anus they are present, perianal region, right? Now when we cut down all these abscesses, this is how it becomes. You see, it is looking like an internal can or internal room, right? So this is what is called as perianal abscess or water can perineum. Water can perineum. Water can perineum or perianal abscess. Perianal abscess or water can perineum. Where do you see this? You see in women. Where do you see this? You see this case in women. This is the first important thing. So in the women, how does gonococci affect? It would cause water can perineum or perianal abscess. I think this is clear for you. Second important thing. What is the second important thing? Second important thing is that let us say that this is the liver of the patient. Okay, this is the liver. Let us also tell that this is the ureter, fallopian tubes all the way in this way, right? Now all of you look here. You know that this is uterus. Okay, you know that this is fallopian tube. Sometimes there can be an infection here. This is called as, what is this infection called as? Pelvic inflammatory disease. What is the infection of the ureter here? This is called as pelvic inflammatory disease. Okay. So whenever there can be pelvic inflammatory disease, or let us say in general I'm talking, whenever there is infection within the uterus, whenever there is infection within the fallopian tubes, what can happen? The infection from the uterus and from the fallopian tubes, they will go all the way. I mean, they will spread all the way to the liver. Okay, they will spread all the way to the liver. And what will they do is that they will damage the outer covering of the liver. They will damage the outer covering of the liver. It means the damage is happening in the liver or outside the liver. Outside the liver. Okay, outside the liver, you call it as perihepatitis. Peri in the sense surrounding the liver. Okay, so this condition you call it as perihepatitis. Perihepatitis. Okay, what is the other name for this perihepatitis? It is also called as Fitz Hugh Curis syndrome. Fitz Hugh Curis syndrome. T is silent. Fitz Hugh Curis syndrome. Nishoka, very good. This is called as your Fitz Hugh Curis syndrome. Clear? Now, all of you just look here. All of you look here. See, what is this picture actually? Actually, this is the liver. This is the liver. Okay. Above the liver, you will have abdominal wall. Yes or no? Let us say there is a peritoneal covering. What is the peritoneum that is covering the liver? Obviously, the visceral layer of the peritoneum. Let us say there is the internal abdominal wall. Okay. Now, between the internal abdominal wall and between the liver, what did I tell you? The infection is on the liver, surrounding the liver. So you see some strings there on the surface of the liver, right? These strings indicate the infection. And these strings, they look like violin strings. Yes or no? So if you see violin string appearance around the liver, this infection is mainly caused by which bacteria? That is gonococci. And what is the name of the infection? Perihepatitis, not inside the liver, surrounding the liver, perihepatitis. Or you call it as Fitz-Hugh-Curis syndrome. So here this shows what kind of appearance, guys? This shows violin string appearance. Violin string appearance. Violin string appearance. Okay. So this is what I want you to know. Everyone is clear till here. Batao, jaldi batao. We don't have time. Fatafat. Everyone is clear? All the 36 members here. Very good. Very good. Till here you understood. Okay. Now all of you just concentrate on the last important thing. In the females, two important things: water can perineum, perihepatitis. Okay. Next, now when it comes to neonate, what can be the problem? See, for example, let us say mother is having gonorrhea. Mother is having, gonococcal infection. Mother is having what? Gonococcal infection. Now, she is giving birth to a baby. Now, when she is giving birth to a baby, where will the gonococci? The gonococci will be on the mother's, let us say the woman who is going to give birth. The gonococci will be on the vagina because it is a sexually transmitted disease, right? So it will be on the vagina. Now, as the baby is coming out, the baby's face will be in contact with the vaginal lips. The vaginal lips are like this. The baby is coming out like this. Okay. So the vaginal lips are loaded with bacteria, which will come in contact with the baby's eyes, baby's mucous membranes and all. Okay. Out of all, the tissues which are very, very delicate are the eyes. So what will happen when gonococci will directly land on the eye? Very good, Saida. When it will land on the eye, this would result in a condition called as ophthalmia neonatorum. Okay, ophthalmia neonatorum. This is the condition. You see the eyes here? ophthalmia neonatorum. Ophthalmia neonatal. This is the condition that is seen in neonate. This is a condition where you see this condition in neonate. So what you have to do? What you have to do is that, will the baby develop gonococcal infection within seconds after the delivery? No. It would take 2 to 3 days. But we are not sure. We are not sure. So what you have to do as a prophylaxis, as a preventive measure, what you do is immediately after birth, you need to start giving topical medicines. Topical matlab which you apply on the top. Okay. So what do you give? You give topical erythromycin, or topical tetracycline, or topical silver nitrate. So ये erythromycin जो है, these are the ointments which you give to the patient. What is silver nitrate? Silver nitrate is nothing but the drops. Okay, eye drops. Silver nitrate eye drops. Clear, all of you? Now, one very important thing you need to know. What is the method that is used in case of, what is the method you follow to prevent gonococci infection or to prevent ophthalmia neonatorum? Method क्या होगा? Method कुछ नहीं है, ये तो 3 drugs which you give to the patient. The method in the sense, silver nitrate जो दे रहे हो ना, you are giving silver nitrate drops to the neonate, right? This giving silver nitrate drops to the neonate is itself called as Creed's method. Creed's method. So from now onwards, if someone is asking you what is Creed's method, what will you tell? You have to tell that we give silver nitrate drops to the neonate to prevent from ophthalmia neonatorum. Okay. So this method is called as Creed's method. All of you understood here? Till here, everyone understood, yes or no? Very good. Right. All of you understood, right? Very good. Now, some few MCQs which are all the time asked. What are those MCQs are? What is the most common cause? I think I have discussed this. Most common cause of pelvic inflammatory disease. PID मतलब pelvic inflammatory. मैं लिखता हूँ. Pelvic most common cause of pelvic inflammatory disease. कहाँ पे? Worldwide. What is the most common cause of pelvic inflammatory disease worldwide? What is that? Tell me. The answer will be gonococci. Gonococci is the most common cause of PID worldwide, not in India, worldwide. Then in India, what in India? In India, it is mainly what? कौन बताएगा? In India, what is the most common cause of pelvic inflammatory disease in India? Be fast. Most common cause of pelvic inflammatory disease in India. Very good, Nishoka. Very good. So that is your TB. Okay. TB. Yes. Don't think that will TB cause. Yes. TB also will cause. Okay. So TB is the most common cause in India. Now another question. Most common cause of septic arthritis. Most common cause of septic arthritis in adult. What is the most common cause of septic arthritis in adult? That is gonococci. Gonococci is the most common cause of septic arthritis in adult. Okay. Gonococci is the most common cause of septic arthritis in adult. Keep that thing in mind. Septic arthritis matlab infection to the joint. When most commonly which joint? Most commonly the knee joint. So a patient will come to you, usually an adult, right? 25 to 35, between that, he will come to you complaining of only one side. I mean, unilateral. The knee joint will be swollen. It will become red and it is very painful, right? Now, if he's asking you, doctor, what can be the reason for this? 99.9% cases, it is mainly because of gonococci. Okay. So, an young adult coming with septic arthritis is always and always gonococci until proven otherwise. Okay, unless and until you come and tell no, this can also be because of another bacteria. If you prove that, till then the statement is gonococci only. We believe it is gonococci only. Keep that thing in mind. Okay. Now, what till here all of you understood, right? Now I'm jumping on to the treatment procedure. What is the treatment which you give in meningitis? What is the treatment which you give in gonorrhea? Sorry, gonococci, Neisseria gonococci. Now, coming to the treatment that is given in meningitis, first let us discuss the initial therapy. What is the initial therapy which you give to the patient? The initial therapy here which you give is cefotaxime. What is that? Cefotaxime. Just remember the drugs. However, in pharmacology, you will be taught very detailedly. Cefotaxime or ceftriaxone. Ceftriaxone. Sir, क्या है ये cefotaxime और ceftriaxone? All these are cephalosporins, third generation cephalosporins. What are all these? These are your third generation cephalosporins. Third generation cephalosporins. Clear all of you? Clear everyone? Yeah. Now, what is the initial therapy which we give? What is the initial therapy which we give in case of Neisseria gonococci? Same drugs. Okay. Same drugs. What I will do is that I will just copy paste all of this. Okay. Same drugs you will give to the patient. Clear all of you? Now, you might get it out. For example, if the patient has become resistant to this, there is a patient of gonococci infection. You are giving him cefotaxime, right? You are giving him ceftriaxone. Still, it is not working. Still, the infection is spreading. Then what you need to do? It means this patient is resistant to these drugs. In that case, you need to switch on to penicillin. Switch on to penicillin. So this is the treatment procedure which you give to the patient. Clear all of you? Everyone is clear, yes or no? Jaldi batao before we go on to the MCQs. Yeah? Very good. Right. Now, all of you look at these MCQs here, which were previously asked. 22-year-old man presented with high-grade fever and purputic rash. Okay? Purputic rash. CSF shows gram-negative diplococci. Gram-negative diplococci causing a purputic rash. Okay? What is the most probable etiological agent? बताओ कौन बताएगा आंसर? वेरी गुड निधि जैन. अगर ये देखो ये क्वेश्चन बहुत इजी है. क्यों? क्योंकि दे हैव गिवन नेसीरिया मेनिंजाइटिस हियर इंस्टेड ऑफ एक ऑप्शन नेसीरिया मेनिंजाइटिस. ठीक है, आई एम गिविंग अनदर ऑप्शन एज नेसीरिया गोनोकोकाई. नाउ व्हाट विल यू टेल? डोंट पुट एज नेसीरिया गोनोकोकाई, क्योंकि नेसीरिया गोनोकोकाई में वी डोंट सी रैश, है ना? वी डोंट सी रैश. एंड इन नेसीरिया गोनोकोकाई यू डोंट डू सीएसएफ एनालिसिस. What will you do? You will take the urethral discharge, जो है ना, you will take that and put it under a microscope. Okay, you do the culture of that urethral discharge. Clear all of you? So Neisseria meningitis. Keep this thing in mind. A patient presents, ये देखो, a patient presents with urethral discharge. Okay, gram stain smear is made from the discharge. What is the most likely? ये देखो, what is the shape here? What is this? Kidney shaped organism. What is this kidney shaped organism over here? बताओ. Neisseria. Neisseria के बाद क्या आना चाहिए? What should come after Neisseria? जल्दी बताओ. Very good. Neisseria gonococci. Neisseria gonococci. Clear all of you? So max to max, these type of questions can be asked. But whatever question they will ask you, definitely they will tell you that हमने culture निकाला. नहीं तो they will tell we have taken a sample of CSF, we have taken that sample, we have taken this sample. But in that we found there is a gram negative diplococci. जब भी ये बात सुनते हो gram negative diplococci, keep in mind two things: gonorrhea, meningitis. If it's giving some symptoms of rash, symptoms of headache and all, then it is meningitis. If it's giving symptoms of urination, urinary problem, all the problems related with the urogenital region, then it is gonococci. Very easy to answer these questions. Clear all of you? Now, there are some questions. where urethritis, I told you urethritis most commonly is caused by gonococci. Now there are some organisms, right, which cause urethritis, and these organisms are not gonococcal organisms. So such kind of urethritis you call it as non-gonococcal urethritis. So these organisms are called as non-gonococcal urethritis. Okay. So urethritis is caused by non-gonococcal organisms. It means organisms other than Neisseria gonococci. So what are these organisms? We shall discuss right now. How do you remember these organisms is that? Remember it like this. My classmate, my classmate can trigger herpes. My classmate can trigger herpes. My मतलब क्या होगा? What is my? My in the sense mycoplasma hominis. Mycoplasma hominis. Mycoplasma hominis. Okay. My in the sense mycoplasma hominis. CLA. What is CLA? CLA stands for Chlamydia trachomatis. Chlamydia trachomatis. The complete name is Chlamydia trachomatis. Chlamydia alag, trachomatis alag nahi. Chlamydia trachomatis. Okay. What is CAN? CAN stands for Candida. All of you know Candida. Candida. Candida albicans. पूरा नाम क्या है? Candida albicans. Okay. You remember in Candida albicans I told you, and also in diphtheria I told you. Diphtheria में जो pseudo membrane है, which is deposited on the tonsils, when you try to scrape it off, that will bleed or it won't bleed. बताओ. In diphtheria, when you are trying to scrape off, will that bleed or it doesn't bleed? Be fast, be fast. It will bleed. Very good. When it comes to Candida, when you're trying to scrape off that membrane on the tongue, right? That plague on the tongue, whatever is there, white color plagues, that will not bleed. ये difference याद रखो, ठीक है? Right. Now, when it comes to trigger, TRI मतलब क्या? Trichomonas vaginalis. Trichomonas vaginalis. Trichomonas vaginalis. Okay. Next, herpes. Herpes in the sense herpes virus. So all these are the things which are these, ye batao, are these gonococci? No, but still they cause urethritis. Ye yaad rakho. They cause urethritis. Clear everyone? Everyone is clear? Till here, you are clear with this? Now, if you remember the table previously which I have drawn, right? If you remember the table which I have drawn previously, if you remember the table which I have drawn previously, ये देखो ये वाला table. In this, I discussed about catalase negative. Catalase negative में streptococci. Streptococci I have divided into alpha, beta, gamma. Okay. Alpha we are done. Viridin streptococci discuss किया. Streptococcus pneumonia भी discuss किया. Now we will discuss about beta. So just look at this beta. ये देखो. Catalase में streptococci divided into alpha, beta, gamma. Alpha we are done. Streptococcus viridans and pneumonia. Streptococcus pneumonia. है ना? दोनों discuss किया. Now I told we will discuss beta. Now beta based upon bacitracin. Again, फिर से, what is bacitracin? Bacitracin is a tablet. In my previous lectures for all online viewers, right? I'm telling you, if you don't know what is bacitracin and all, I have already discussed in the previous lectures. So watch those previous lectures, okay? So all of you guys remember, right? यहाँ पे जो class में है now, what is a bacitracin? You put a tablet of bacitracin in an antibiotic tablet. You put a tablet within the bacteria. If the antibiotic will kill down the bacteria, you will see a zone of inhibition. If it is not killing, there is no zone of inhibition. So by this way, you can tell which bacteria is resistant, which bacteria is sensitive. Okay? क्या है कि नहीं? Yeah, very good. Now, which bacteria is sensitive? Sensitive is gas. Gas bacteria मतलब क्या? Group A Streptococci. Group A Streptococci. Textbooks में ना you will see a abbreviation called gas. ठीक है? Group A Streptococci. Resistant कौन सा है? GBS. That is Group B Streptococci, group B Streptococci, that is GBS, gas and GBS. What is the organism that is group B Streptococci? That is your Streptococcus agalactiae. Streptococcus agalactiae. Okay. What is your group A Streptococci? Streptococcus pyogenes. Streptococcus pyogenes. Very, 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 very important. Streptococcus pyogenes. 100% one question will be asked every year from Streptococcus pyogenes. Ye yaad rakho. Okay. Right. First of all, let us discuss about Streptococcus pyogenes and see what question will be asked. The name itself, the name itself tells you Streptococcus pyogenes मतलब क्या? Pyo मतलब क्या? Pus. So pus releasing bacteria is Streptococcus pyogenes. Okay? मतलब ये खुद release नहीं करता pus. It won't release pus by itself. It will make us to release the pus. Okay? So remember the mnemonic. Homes, Homs, Gar, Homes. You enter into the house, right? Let us say there is a terrorist in the house. You enter into the house and kill all the terrorists that are present in the house. It means kill the house. Homes, kill the home. Homes, kill the home. Okay. Right. Now, what does it means by homes and kill the home are? These are individual enzymes, individual toxins that are released by this Streptococcus pyogenes. Okay. One by one, we will discuss. First, H. What does H stand for? H stands for hyaluronic acid capsule. Hyaluronic acid capsule. What do you mean by hyaluronic acid capsule? Let us say this is your Streptococcus over here. Okay. Surrounding this Streptococcus, there is a capsule. Surrounding this Streptococcus, there is a capsule. This capsule is called hyaluronic acid capsule. Jo bhi hai. If the capsule is made up of hyaluronic acid, if the capsule is made up of polypeptide, जो भी है, what only thing we know is that अगर capsule है, capsule has got one property. What is that? Antiphagocytic. What is that? Antiphagocytic. Capsule will not let the phagocyte to come and eat up the bacteria. It is antiphagocytic. So wherever you see the capsule, the only answer that should come out of your mouth is it is antiphagocytic. So first function क्या है? Pyogenes का with the help of hyaluronic acid capsule, antiphagocytic. So now no phagocytes can come and eat up the bacteria. हो गया? अभी second function देखो. Second function is that this Streptococcus pyogenes will release O. What is O? O is nothing but streptolysin O, a toxin called streptolysin O. Okay, it releases a toxin called streptolysin O. What is the function of streptolysin O? Streptolysin O will destroy. It will destroy your WBC. It will destroy your RBC. WBC को destroy करेगा, RBC को destroy करेगा. If WBC are destroyed, do you think can our immune system fight against this infection? अगर न्यूट्रोफिल्स नहीं है, एसिनोफिल्स नहीं है, बेसोफिल्स are not there, macrophages are not there, how do you think it will fight against the infection? It can't fight. Normally, whenever you get cough, when I have a cough now, when you get cough also, when you check your throat culture, right? Within that, there will be elevated levels of streptolysin O, right? Whenever they take a sample of blood, right? Within the blood sample, when you send it for the culture and all, if you see, there will be elevated levels of streptolysin O, which means normally you have got a throat infection. Okay. So how do you see whenever you get a report, there will be, whenever streptolysin O is released in our body, against that streptolysin O, there should be some antibodies released. That is a normal thing which happens. Yes or no? What are the antibodies that are released? Anti-streptolysin O antibodies are released. So when you are checking the serum, when you are taking the blood, right, centrifuging it, when you look at the serum, within that serum, anti-streptolysin O antibodies are there, which means you have this infection right now within you. Clear, all of you? Everyone is clear? Right. Third important thing. What is the third important thing? Third important thing is that if this is a bacteria over here, if this is a bacteria, if this is a bacteria over here, see on the surface of bacteria, there is M shape. You know, what is this M shape here? This is nothing but called as M protein. What is this? This is nothing but called as M protein. Guys, if you are with me from the starting of the class, in the first class, I think I have told you what is the function of M protein. You remember? Now, generally, molecular mimicry, you remember that concept which I have told you, right? For all those who don't know, just listen briefly. I'm telling, I won't write it down. M protein is present on the bacteria. M protein is also present on your joints, on your heart tissue, cardiac tissue also. So what your body knows that, your body knows to attack the M protein only. So whenever this bacteria is entering into your body, your antibodies, your macrophages, whatever are there, your antibodies, whatever are there, I think especially IgG antibodies, they go and attack wherever there is M protein. So they go and attack the bacteria because bacteria is having M protein. They also go and attack your normal tissues like heart and joint. Okay. If your heart tissue and joints are attacked, this would lead to a condition called as rheumatic fever. Okay. But whatever it is, in there I've told you much more detail. Here, just one point you need to know. If a bacteria is having M protein like Streptococcus pyogenes, this would cause what? This would cause molecular mimicry. Molecular mimicry, which would lead to acute rheumatic fever. Acute rheumatic fever. This would lead to acute rheumatic fever. You guys are enjoying there, right? With the cold, it is so hot here. You see, remote is also not working. Chalo, leave it. Right. So next important thing, what is the next important thing? HOMS is done. HOMS is done. Now KDH. What does K stand for? K stands for kinase. What is this? K stands for kinase. So what is this K? HOMS. Yeah, K stands for kinase. That is your streptokinase. Streptokinase. So what is this streptokinase? Now, all of you know this important thing. What is this K? K stands for streptokinase. What does streptokinase do is that this would convert plasminogen in your blood, to plasmin. It would convert plasminogen into plasmin. What does plasmin do? Wherever there are blood clots, right? Let us say here there is a blood clot. ये plasmin आएगा. Plasmin is like a scissor. It will come and cut down the blood clot. It means it is dissolving the blood clots. It means it is promoting the blood clot or it is promoting the bleeding. Satish, it is promoting the blood clot or it is promoting the bleeding. Yeah. Very good, very good, very good. It is promoting the bleeding. So in this patient, by chance, if he gets any kind of injury, in case if he gets any kind of injury, then what will happen? There is bleeding that will be seen in the patient. Bleeding that will be seen in the patient. The next important thing is KD. What does D stand for? D stand for streptodornis. Streptodornis. D stands for streptodornis. ये streptodornis का दूसरा नाम है. The other name for this streptodornis is DNase B. What is the other name for this? That is your DNase B. So what will this streptodornis do? What does this streptodornis do is that this breaks down your DNA. Cell के अंदर DNA होगा ना? So what will it do? It will break down your DNA. So when it will break down your DNA, obviously no proteins are produced. Yes or no? There is no protein synthesis that is happening. Right. Next important thing, the last important thing is point number 6. Ye dekho. H. What does H stands for? H stands for an enzyme called hyaluronidase. H stands for an enzyme called what? Hyaluronidase. You know what is the importance of this hyaluronidase? This hyaluronidase enzyme will cause the bacteria to penetrate deep into the layers of the skin. Hyaluronidase will penetrate, it pierces deep layers of the skin, deep layers of the skin. Okay, it will pierce the skin so that the bacteria can penetrate deep into the skin. Very good. Now you tell me how dangerous this bacteria is. First is it is antiphagocytic. Second is it is destroying your WBC, RBC. If RBC are destroyed, you will have anemia. If WBC are destroyed, then you can't fight against infections. Third important thing, molecular mimicry, which would lead to acute rheumatic fever. Fourth important thing, there is bleeding everywhere going on in your body. Fifth important thing, your DNA is getting damaged. And sixth important thing, all your tissue layers are pierced down. Okay, they are penetrated deep inside. So that is the reason why the Streptococcus pyogenes infections are very, very, very dangerous infections. Okay, very dangerous infections. Because of this Streptococcus pyogenes, you will have many types of diseases. For example, what are the basic diseases which you would see? First important thing, what did I tell you? I told you that whenever you have severe throat infection, severe cough, in that condition, you take a blood sample and see anti-streptolysin O antibodies, which are called as ASO titers. They are elevated. So can I tell Streptococcus pharyngitis is causing throat infection? This throat infection is also called as what? Streptococcus pharyngitis. Okay. This is called as Streptococcus pharyngitis. Streptococcus pharyngitis. Okay. So to detect Streptococcus pharyngitis, what is the test we do? For example, you came to me. Let us say in a city, there are thousands and thousands of patients. Now, will you give an appointment every day for one patient and come sit down, take a sample, your results will come in the evening, you can go to home? No, you have to immediately do the test. So you have to detect this Streptococcus pharyngitis very rapidly. For that, the test which we do is rapid antigen detecting test, which you also called as RAD test. Okay, rapid antigen detection test, rapid antigen detection test. This is the test we do. Apart from this test, the second test which we can do is throat culture. Throat culture. Either of these two tests you can do to the patient. Clear, all of you? Everyone is clear? Yes or no? Jaldi batao, guys. Very good. Very good. Second important test. What is the second important thing you do? What did I tell you? I told you that this bacteria will release hyaluronidase, and so that the bacteria will penetrate deep into the skin. Agar if it is penetrating deep into the skin, don't you think it can cause skin infections, right? So it can cause skin infections. Now, when you look at the skin infections, there are three different types of skin infections it will cause. One is this would cause this particular infection, and this is called as folliculitis. Folliculitis. Folliculitis matlab, guys, I think most of us have got folliculitis. Kuch nahi hai. What is follicle? Hair follicle. Surrounding the hair follicle, if you get an infection, that is called folliculitis. So can I tell folliculitis is always associated with a hair follicle, right? You see a pimple over here. Now you closely examine in the center of the pimple. If you see hair follicles, it means that is folliculitis. Okay. So most of you, you keep on pinching that pimple, है ना? Later on your face will be damaged. You will see the pits that will be formed there. Don't do these things. Whenever you get pimples, even you have a lot of urge to pop it out, don't pop it out. Just leave it like that. If you want a fair skin, leave it like that. Okay. One best thing I want to tell you here is, which is apart from the subject, yeah? One best thing is that always use vitamin C serum. Okay. Vitamin C serum will not cause any kind of folliculitis. That will help and protect your skin from folliculitis. ये याद रखो. Early in the morning, when you cleanse your face, take your bath, right? Before going outside, whatever it is, add drops of vitamin C serum on the face and apply it. Okay, that will protect your skin from folliculitis. Next important skin infection which you would see over here is this one. What is this? This infection is called as cellulitis. What is this? Cellulitis. Guys, एक चीज याद रखो, cellulitis is most, it can be seen everywhere in your body, but most commonly in the leg region only. So it is seen most commonly in the legs. Cellulitis is most commonly seen in the legs. Okay, most commonly seen in the legs. Third important thing is that you would see a very, very important infection, which is all the time asked. This is called as, what is this? Anyone can answer this? Anyone who will answer me? What is this called as? Batao. Okay, no problem. This infection, you call it as impetigo. Impetigo. Okay, this infection called as impetigo. Abhi yahan pe, this impetigo is most commonly seen surrounding the mouth, and you look at the lesions of this impetigo. This is crusted, है ना? Crust shape में है, पूरा crusted है, crusted lesions. So these lesions are called as honey crusted lesions. What are these lesions called? Honey crusted lesions. अगर question में if you see golden, yellow, honey crusted lesions in the exam, directly go for Streptococcus pyogenes. ठीक है? अभी मैंने जब impetigo बताया, two important things. If you remember, I told you impetigo somewhere else also. Where did I tell you impetigo previously? बताओ. Anyone? Fatima? Nidhi? Any idea? Bullous impetigo, I told you. Where did I tell you bullous impetigo? Yes, I'm waiting for your answers. Be fast, be fast, be fast. What happened? Very good. Cephalococcus, but which infection? Golden yellow, you remember? Golden yellow colonies. Golden yellow color colonies. Where did you see golden yellow color colonies? Very good. Staph aureus. If you look at the pages where I have taught you Staph aureus infection, there I told you, मैंने वहां पे इतना मेहनत करके मैंने एक पिक्चर भी बनाया आप लोगों के लिए. I have drawn the picture of epidermis. I have explained you desmosomes. क्या होगा अगर desmosomes will be damaged? Water will come accumulate. It will cause swelling of the tissue. All these things I have explained in detail. So I think from your junior batches and all, I will prepare a PPT. है ना? PPT पढ़ाना शुरू करूँगा. Don't tell your junior batches about me, okay? Don't give them any kind of expectations. From next batch, I decided I will teach them only PPT. Very poor memory. Girls will never ever have poor memory. Trust me. मुझे बहुत अच्छे से पता है. Girls can never ever have poor memory at all. Okay? They will forget the thing which they left it. Okay? A day before, but they will not forget a word which you told them an year before. बहुत अच्छे से याद रहते हैं. So if boys are telling, sir, poor memory problem, I agree. But girls can never have a poor memory problem. They're very, very good at arguments, right? Chalo. So these are the honey crusted lesions over here. Now, what is the difference which you can point out in Staph aureus, Streptococcus pyogenes? ये देखो, फिर से. Staphylococcus aureus, Streptococcus pyogenes. Staphylococcus aureus में भी impetigo है. यहाँ पे भी impetigo है, right? The impetigo which you see in Staph aureus is bullous impetigo, क्योंकि वहां पे you see fluid filled bulla or fluid filled swellings you see there, right? Or fluid filled bubble like things on the skin. These are simple terms which are using, but you have to call it as bullae. Fluid filled bullae are used, seen there. But here, this is not fluid filled bullae. That is why this impetigo is called non-bullous impetigo. वहां पे वो bullous impetigo था aureus में. यहाँ पे this is non-bullous impetigo. This is what? This is non-bullous impetigo. Non-bullous impetigo. This is what? Non-bullous impetigo, honey crusted lesions. Okay, you see this picture, directly go for honey crusted lesions, Streptococcus or Streptococcus pyogenes. Okay, so three important kind of skin infections: folliculitis, cellulitis, impetigo. Sir, for all these three, what is the medicine you give? There is only one antibiotic which you give, that is flucloxacillin. For all these three skin infections, you give flucloxacillin. You give flucloxacillin. Okay. Next important thing is that in these patients, third important thing, in these patients, you see this kind of rash, right? So this kind of rash is called as scarlet red rash. Scarlet red rash. When you try to feel this scarlet red rash, what will happen is that you will feel as if you take a paper, you add gum to that paper, okay? You add sand on it. Okay, you take another paper, you add gum to that, add sand on it. Now you try to rub these papers against each other, or let us say you try to feel one of the paper. When you try to feel, you will see a feeling. What is that feeling? That is called as a sandpaper like feeling, right? The same thing is here. This kind of rash feels like a sandpaper like rash. Okay, what is the feeling which you see? Sandpaper like feeling. Sandpaper like rash is called as scarlet red rash. Okay. Along with this, patient will have fever. What is this? Patient will have fever. Along with this fever, patient will have strawberry tongue. Strawberry tongue. Okay. Along with this, strawberry tongue. So, scarlet red rash, fever, and strawberry tongue. Three of them together you call it as scarlet fever. Three of them together you call it as scarlet fever. All of you understood now what is scarlet fever? Whenever I tell you scarlet fever, most of you directly you will tell strawberry tongue. No. Strawberry tongue, fever, scarlet red rash, which feels like a sandpaper. Together you call it as scarlet fever. Clear? The last important thing what can happen to the patient is rheumatic fever. Rheumatic fever. So these are in rheumatic fever also you have got a criteria called as Jones criteria. I will tell you that in a minute. Okay. But all of you remember what are the four important problems which you see. First, Streptococcus pharyngitis. Second, skin infections. Third, you will see scarlet fever. Fourth, you will see rheumatic fever. Okay. So whenever a patient is having rheumatic fever, rheumatic fever is mainly caused by the antibodies, your own antibodies. Your own antibodies start damaging your own tissues, which would lead to rheumatic fever. Now, this rheumatic fever, how do you diagnose? If a patient is coming and telling, doctor, I have rheumatic fever, how will you diagnose? Now, whatever points I'm telling to you, remember it lifelong. Every subject, this topic will come. Every subject, they will discuss this rheumatic fever criteria. In micro, we don't have that criteria. I'm putting it from Davidson Medicine here. So I'm telling you, remember whatever I'm telling you. Okay. So the criteria which you see here is called as Jones criteria. What is the criteria? That is called as your Jones criteria. What is this Jones criteria? In this Jones criteria, what is JONES? J stands for joints. Patient is having problem with the joints. Okay. What is the joint problem? Patient will come and tell, doctor, I had elbow pain yesterday. Sorry, not yesterday. Let us say 3 weeks back, I had very severe pain in the elbow. Early in the morning when I get up, I can't even stretch my elbow like this. Very severe pain. Slowly after 3-4 days, the elbow pain shifted to my hip. From there, the pain shifted to my left leg. From there, my pain shifted to the right knee. So it means this arthritis is occurring to multiple joints. First thing. So if it is occurring to multiple joints, I call it as polyarthritis. और ये polyarthritis जो है, it is migrating from one place to another place. So this kind of polyarthritis, you call it as migratory polyarthritis. Very, very important. Don't just tell it as arthritis. Migratory polyarthritis. पूरा word use कर लो. Migratory polyarthritis. Okay, fine. Next, O. O looks like a heart. Okay, O looks like what? O looks like a heart. Anyone had heart breaks previously? Yeah? Don't tell yes. If you had a heartbreak, you might not attend my class by now. And there is nothing such thing called as heartbreak. So O stands for heart. What is heart? It will even affect your heart. For example, carditis. Affect your heart in the sense carditis. Or heart के अंदर क्या होगा? Valves, valvulitis, valvulitis, carditis and valvulitis. Clear all of you? Next, JON. What does N stands for? N stands for nodules. N stands for nodules. कौन सा nodules? In these patients, just beneath the skin, you will see nodules, bumpy elevations you will see. You can actually palpate them. You see, palpate the bumpy elevations. They will feel exactly they are present beneath your skin. So anything present beneath your skin, can I call them as subcutaneous nodules? Very good, Nishoka. That is subcutaneous nodules. These nodules are subcutaneous nodules. Okay. Next important thing after nodules is E. What does E stand for? E stands for a specific rash that is called as erythema marginatum. Erythema marginatum. Erythema marginatum is the specific rash that is seen here. What is this erythema marginatum? बहुत सारा rashes है guys. एक है, one is called erythema migrans. One is called erythema marginatum. Okay. One is called erythema nodosum. ऐसे बहुत सारा rashes है. Those things you will study in dermatology. Okay. Now, what do you mean by erythema marginatum is that this rash will be circular. Okay. This rash will be like this. This rash will be in this way, circular. So such kind of rash which is circular and it is growing in size is called as erythema marginatum, right? If you want, you can Google it, the rashes, you will see it on the palms also. This is called as erythema marginatum rash. Next, last, JONES. What does S stand for? S stands for a problem called as Sydenham chorea. Sydenham chorea. So in this Sydenham chorea, there will be, what is Sydenham chorea is that basically brain ke andar na, in anatomy I will teach you, within the brain you have got basal ganglia. Okay, so there we have got caudate nucleus, we have got globus pallidus, putamen and all. So damage to one of these structures will lead to chorea. What is this Sydenham chorea is that there will be flinching of the fist. Ye dekho aise. Okay, and patient will be involuntary, he will be jerking like this. You see, in this he will be involuntary, not intentionally, subconsciously only, right? Without a voluntary control, automatically he will be doing these kind of activities. So these kind of activities is called as Sydenham chorea. So two important things you see in Sydenham chorea. What is this thing? Flinching, and second important thing is jerking. So these are the two important things you would see in the patient. Okay, we are done with the zones. ये जोन्स जो है ना, these are major problems, इसीलिए इसको major criteria बोलते हैं. Okay, what do you call this entire criteria as? JONES. All these 5 important things together you call them as major criteria. They are called as major criteria. They are called as what? Major criteria. Now, when I tell major criteria, there will also be minor criteria. Yes or no? When I tell major criteria, there will also be minor criteria. What is this minor criteria? Minor criteria you can remember by the mnemonic FAME. FAME. What is F? F stands for fever. F stands for fever. Not only fever, first degree heart block. First degree heart block. Okay. Next, A stands for arthralgia. A stands for arthralgia. Arthralgia matlab joint pains. Okay. What does M stands for? M stands for minor. What does M stands for? M stands for minor. M stands for minor criteria, and E stands for elevated ESR and elevated CRP. Now here one thing I want to clarify it to you, as you are the juniors here. Here they go. Elevated CSR ERP matlab next time when anyone is sending me any report, right? Before you send me any report, most of the students usually do. Before sending me any report, you don't diagnose it by yourself. CRP or ESR हर एक infection में elevated होगा, है ना? Now don't think यार CRP बहुत elevated है. Nothing is going to happen. It means he is having a the infection is too high in his body. That is the only thing. Okay. So basically this is a CRP C reactive protein that is basically released from the liver. Whenever I have infection, immediately the liver will release some responsive protein. It is like a liver cry. Liver is crying. While crying, tears will come out. These tears are nothing but CRP. The more the tears, the more the infection. That is the thing. Okay. ESR is erythrocyte segmentation rate. This will also indicate infection only. So excess ESR, it means some bigger disease. No. Even if you have normal fever, normal viral fever, and these also, this ESRs will be elevated. Okay, don't worry about that. So there are two criteria here: major criteria, minor criteria. Now, how do you diagnose this patient? How do you diagnose this patient is that if any patient is coming to me, right? If any patient is coming to me with two major criteria, ठीक है? एक पेशेंट आ रहे बोल रहे डॉक्टर आई हैव माइग्रेटरी पॉलीआर्थराइटिस, ठीक है, एक मेजर क्राइटेरिया है. डॉक्टर आई आल्सो हैव सबक्यूटेनियस नोड्यूल्स, ओके, यू हैव गॉट अनदर मेजर क्राइटेरिया. इट मींस यू आर हैविंग व्हाट? रूमेटिक फीवर. सो आइदर टू मेजर क्राइटेरिया होना चाहिए और देयर शुड बी वन मेजर प्लस टू माइनर. वन मेजर और टू माइनर. वन मेजर मतलब माइग्रेटरी पॉलीआर्थराइटिस है, उसके साथ साथ patient should have fever and elevated ESR CRP, और fever और arthral जो भी है minor criteria में दो और एक major criteria. Even this will also give you a diagnosis. Sir, एक ही major criteria है, एक ही minor criteria है. No, you cannot consider it as rheumatic fever. Everyone understood? जल्दी बताओ फटाफट. Yes or no? Be fast. Perfectly clear. All of you are understanding, right? This is all the clinical part which you would see. अभी यहाँ पे confuse मत होना guys. This I think you have studied in physiology. Okay, I will put some videos on YouTube regarding ECG. Okay, so in that I will teach you heart blocks also. Heart blocks are first degree heart block, second degree heart block, third degree heart block. In second degree heart block there are two types: Mobius type 1, Mobius type 2. So as I will teach you later on, but just remember it as first degree heart block. Okay, all of you understood, right? Now let us see you really understood or not. Eight questions देखो. Part of the success of Streptococcus pyogenes bacterium lies in its ability to evade phagocytosis. ठीक है? Which of the following helps in the evasion? Phagocytosis. To which is the one which will prevent phagocytosis? कौन बताएगा? जल्दी फटाफट. Very good, Nidhi, very good. Arbina, Romita, Saida Fatima, Hasti, very good. So it is hyaluronic acid capsule. Hyaluronic acid capsule. I told you it is phagocytosis. And you know the remaining functions also, right? Very good, Karan. Physical exam of a 15-year-old female. Yes, अच्छे से देख. Physical exam of a 15-year-old female reveals impetigo around her mouth. Okay. A sample of pus is taken and cultured. Growth reveals gram-positive cocaine chains. Gram-positive cocaine chains मतलब streptococci. और ये क्या है? Bacitracin sensitive. Which is the one which is bacitracin sensitive? Which is the following symptoms would be concerning for a serious sequel of this infection? Yeah, see. First, what infection the patient is having? Tell me. Don't go for the answers. Answers pe mat jao. What infection the patient is having? Tell me first thing. Very good, Fatima. Patient is having Streptococcus pyogenes. How are you telling? First thing is impetigo around our mouth. That is called as non-bullous impetigo or honey-colored crusted lesions. Second is it is gram-positive cocaine chains because it is Streptococci or a basic resin H2A. So by this we understood that it is Streptococcus pyogenes. What can be the worst complication of Streptococcus pyogenes among these? Fever worst complication है बताओ. Is the fever worst complication? Yeah. No. Chorea. Chorea, is it a worst complication? Patient will die with the chorea? No, patient will not die with the chorea. Hematuria. Hematuria matlab bleeding. Bleeding क्या bleeding? Hematuria matlab you see blood in the urine, right? Gross amount of blood in the urine is called hematuria. So will patient will die because of hematuria? No. Joint swelling की वजह से patient मर सकता है? No. But what is the most important? Serious. He has serious sequel. Serious sequel क्या हो सकते हैं? Myocarditis. Myocarditis. Where did we discuss myocarditis? In rheumatic fever. Myocarditis in rheumatic fever. Rheumatic fever. Clear all of you? All of you are clear with this? Everyone is clear, guys? Yes or no? Jaldi batao. Another small topic we have. We will finish this up now. Right? This topic has been asked 4 times in the exam previously. 4 times. Continuously, year after year, 4 times they asked. That topic is nothing but called as Legionella pneumophila. We will follow the table only, but in between, whenever I feel these topics are all the time repeated, I will put such topics inside. So Legionella pneumophila. Okay. Now, and yes, don't worry about the subject and all. What I can guarantee you is that you can roughly blind me. This is the maximum guarantee which I can give to you, right? So the same thing I've been telling from years. Don't worry about that. So coming to Legionella pneumophila, what is this bacteria? This bacteria is a gram-negative rod. This is a gram-negative rod-shaped bacteria. How this bacteria is transmitted is very important. How this bacteria is transmitted is very important. Now, looking at the transmission, how is this bacteria transmitted? For example, if you are sitting in an AC room all the time, now tell me, will that room will be dry or will that room will be moist, somewhat moist? That room will be somewhat moist. Second important thing, if you are in the hot tub all the time, if you are in the hot tub all the time, right? Obviously, what will happen? That area will completely be moist. Second thing, if you are in a swimming pool for more time, then also, and not only that, even if you are traveling in the cruise ships for longer duration, So, what are the things? If you are in the air condition for, क्योंकि ये चीजें ना, they will give you in the question. That's why I'm telling you. Patient returned from a cruise ship, a trip. He went on a trip for 5 days in a cruise ship. He returned. उसके बाद उसको lung infection हुआ. क्या हो सकता है? Legionella pneumophila. Okay. So patient is in the patient daily. He stays in the hot tub. He loves to swim in the, or he loves to take bath. He loves to sleep hours together in the hot tub. And what can be the condition and all? They will ask you. So transmission. First क्या है? Air conditioning. Air conditioning. Second important thing is hot tubs. Third important thing is swimming pools. Swimming pools. Fourth important thing is cruise ships. Cruise ships. So these are the 4 important transmission routes. So because of this, what disease you're going to get? There are 2 important diseases. Because of this Legionella pneumophila, there are 2 important diseases that you would see in a patient. So one disease is called as Legionnaire's disease. What is this? Legionnaire's disease. और दूसरा डिसीज क्या हो सकता है? Pontiac fever. Pontiac fever. ठीक है? So what are these 2 diseases? One is called Legionella disease, another one is called as Pontiac fever. Pontiac fever क्या है? ये सुनने में तो it looks very strange name. Do you think the infection is very typical type of fever? कुछ नहीं है. Pontiac fever, I will tell you once I tell you this Legionnaire's disease. What is this Legionnaire's disease? Is that in Legionnaire's disease, the first important thing you will find is pneumonia. In this patient, you will see pneumonia. Second important thing you would see in this patient is gastrointestinal symptoms. Gastrointestinal symptoms मतलब एक ही gastrointestinal symptom हो सकता है, वो है diarrhea. Diarrhea. Third important thing is neurological symptoms. Neurological symptoms. So in a question, if you see any of these transmission factors, उसके साथ साथ if you see patient is having some problem with the lungs, कैसे? He will tell doctor, I have cough, I have shortness of breath, I have dry cough, I can listen some sounds coming out of my chest whenever I'm breathing. It means there is some problem related with the lungs. He will also tell doctor from 3-4 days I'm even having diarrhea. Now he will also tell doctor nowadays I'm having very severe headache. You're getting it? Headache कौन सा problem है? Gastrointestinal problem है क्या? No. Headache is your problem with the neurological. He will tell 2-3 times I got seizures, है ना? Very severe headache, seizures also I got. So you see 3 important complaints. If you see these 3 important complaints in any question from now, 100% the answer will be Legionella. Keep that thing in mind. Okay? Lungs, stomach, brain. Problem with the lungs, if you see symptoms of lungs, if you see symptoms of stomach, if you see stomach matlab GI symptoms, if you see symptoms of brain, these 3 problems if you are looking in a single question, that will always and always be Legionella pneumophila. ये चीज याद रखो. Okay? Pontic fever क्या है? What is Pontic fever? In this Pontic fever, patient will have flu-like symptoms. Flu-like symptoms. From now onwards, whenever I tell flu-like symptoms, one thing you have to know. What is that one thing you have to know? Right? Ye dekho. Headache. I won't write it here. Write it there. Headache. Okay. Fever. Fever. AK fever. Headache. Myalgias. 3 things. Fever. Headache. Myalgia. Myalgia matlab kya? Muscle pain. If these 3 things you are seeing in a question, it means these are called flu-like symptoms. From now onwards, fix it in your mind. Flu-like symptoms, matlab 3 symptoms. Headache, fever, myalgia. Okay? These are called flu-like symptoms. So patient will have flu-like symptoms without pneumonia. Without pneumonia. Pneumonia nahi hoga. Sirf only patient will have flu-like symptoms. That is what is called as Pontiac fever. Okay? That is what is called as Pontiac fever. So will you remember this, guys? If you have a problem with the lungs, if you have a problem with the GIT, if you have a problem with the central nervous system, 3 problems. After you see any one of these things in the question, will you put it as Legionella? Yes or no? Jaldi batao. Be fast. Be fast. Very good. Very good. Now, how are you going to diagnose this disease? How are you going to diagnose this disease? Guys, क्योंकि ये question ना, this, if just you open your textbook, ठीक है? Legionella pneumophila कहाँ पे भी दिखता है ना? Just type about the topic and see. You will see the symptoms vaguely, rough symptoms दिखेगा. Patient might have dizziness, ये symptoms. But when it comes to the question, you need to know specific symptoms. Only then you can answer it. These are the specific symptoms which I have picked up from USMLE first aid. ठीक है? आज तक question miss नहीं हुआ इस topic से. Whatever I have taught. So keep these things in your mind. Okay. Coming to the diagnosis, the first important point, you will collect the urine of the patient. When you collect the urine of the patient, within the urine, that test which you do is Legionella urinary test. Within that urine, what you will find? Legionella ka antigen दिखेगा. That is why you call it as Legionella urinary antigen test. That is a test which you basically do. Second important thing, what do you do? I wanted to look at the DNA of this particular organism. If you want to look at the DNA, do PCR, polymerase chain reaction. Third important thing, I wanted to look at this organism with my naked eyes. If you wanted to look at these organisms, what you need to do? You need to do culture. That is called as Legionella culture. Legionella culture. We are done with this topic, guys. Two more points and I will leave you. Legionella culture. What will you do is that you take the Legionella culture, okay? You take the culture from the patient and you have to put in some agar and then look, yes or no? Jo bhi culture lete ho, you have to put in some agar. Which agar will you use? The agar will you use is charcoal, yeast, extract agar. Charcoal yeast extract agar. Within this charcoal yeast extract agar, you have got iron plus cysteine. So what? This bacteria, Legionella pneumophila, pata kya karega? It will eat this iron and cysteine within this charcoal agar and it will start growing. Once it start growing, you can put it under microscope and exactly look at this bacteria. Sir, how do you remember all these things? Remember it as Charlie legs. Charlie legs. What is this Charlie legs here? Char matlab kya? Char matlab charcoal. Lee matlab kya? Lee matlab Legionella pneumophila. Okay, again, Lee here is what? Lee is nothing but Legionella pneumophila. And finally, what is S over here? What is S? You use a stain called as silver stain. You use a stain called as silver stain. S stands for what? Silver stain. So Charlie, CHAR stands for charcoal yeast. Charcoal yeast mein you will culture this. Legs, LEG stands for Legionella and S stands for silver stain. The last treatment part over here, if you want to remember, remember it or else leave it. The treatment which you give over here is levofloxacin. Levofloxacin kya hai? It is a fluoroquinolone. What is this? This is a fluoroquinolone. Just remember the drug. Uska class जानने की जरूरत नहीं है. Next, azithromycin, which is a macrolide. These are the two important drugs. Okay. So out of all these tests, first test Legionella antigen test, PCR, Legionella culture. Out of all these, which will you trust? You will only trust, you should always in your life trust those things which you see with your naked eyes, not which you hear. Okay. So whatever you are seeing with your naked eyes here, Legionella culture. Hai? So this is what is called as a gold standard test. Gold standard test. Okay. Keep this thing in mind. Clear all of you? Everyone understood all the things which I have taught? Ye wala MCQ, I'm leaving it for you. I want you to answer. Tomorrow in the class, I will ask you. Okay? So all of you understood all the things which I have taught today, guys? Yes or no? Jaldi batao, fatafat. Very good. Very good, guys. And to finish up the syllabus, this Sunday, shall we put a class? Shall we take a class this Sunday? Bus ek Sunday. Only one Sunday. If you guys say okay, then only one Sunday थोड़ा लंबा क्लास ले लूंगा ताकि सिलेबस फटाफट खत्म हो जाएगा. Please send the Friday class 29 December. ठीक है, I will send it to you. मतलब लास्ट क्लास है ना? लास्ट क्लास है ना? Obviously, I won't take it in the morning. Obviously, Saturday night you don't sleep. Sunday morning you wake up late. I can understand. You know? So we will have class at the same time. Is it okay for all of you? We will have class. कितने बजे? 5 बजे. You guys go to Bishkek, do all the shopping, kachra, and come back. By what time you will come back? Tell me first. All of you guys. When you want me to take the class? 5 or 6? Normal time फिर 6 बजे शुरू करूंगा. You guys Sunday biryani again. You guys will kill me till I leave the class. I'm telling you. You guys kill me literally for the class and all. Leave the class. Biryani hai aaj Sunday. Five o'clock. Chalo, let us fix it as 5. Okay. Chalo, let us fix it as 5. Let us have 3-hour class. 5:30 भी नहीं. कहाँ 5:30? 5 बजे बस. ठीक है. 5 o'clock. Let us start the class. till 7:30 we will have the class. 5 to 6, 6 to 5 to 6, 6 to 7:30. 2.5 hours here at least. Okay? 2.5 hours. We shall cover up at least the syllabus. Okay? Clear all of you? Right. So guys, all of you, let us do one thing. Let us all be in one WhatsApp group, है ना? So that I will what? I will create one WhatsApp group. Okay, we'll all add in that WhatsApp group, and I will also send you notes there also. Okay, so all of you have my mobile number. Just take this mobile number. This is my mobile number. So message me so that I will add you in the group, and after that I will share you the link so that you can add a remaining of your friends into the group also. Okay. So clear all of you understood all the things which I have taught you today. So thank you, goodbye, and love you all.